Hey, and welcome back to the Weight Loss Decoded Podcast, GLP edition. I am Sharon Polsky, your host, the GLP Fact Fairy. And on today's episode, we're going to have Dr. Jim Bowen, and he's from Apex MD. And we are going to talk about the future of peptides. And the reason we're going to talk about this, because in season 2 of this podcast, it is going to be the Peptide Decoded Podcast. And so I really wanted to give you a place to start from so you kind of understand where season 2 is going. So I am really excited to have a conversation with Jim Bowen on the future of peptides. So I want to welcome you to the show, and we have Dr. Jim Bowen on our podcast this morning, and we are talking about the future of peptides, which is a really, really exciting conversation for me. I always nerd out on peptides. I want to welcome you to the show, Dr. Bowen. Thank you so much for joining us. Tell us a little bit about your background and how you got into peptides.
Okay, so my background is varied. I started off in emergency medicine and aerospace medicine. Eventually went back after working in ERs and went and did a residency in physical medicine and rehab and did sports medicine. Spent 24 years in the Navy. I was the chief of the medical staff and a sports medicine physician at the Naval Academy. And then I was the waiver advisor for the Navy. So if you had a medical problem, I was the person to determine along with my staff whether or not you got a waiver. And then I left that and went into orthopedic groups. But while I was there, I developed an interest in orthobiologics. And from there was, how do you make people metabolically healthier? And then GLP-1s came around, and we started looking at other peptides for people that were having pain, because the orthopedic answer is to shoot everybody up with prednisone, right? Or some sort of form of cortisone. And so that wasn't reasonable long term. And then I ended up getting into functional medicine, and I was with the number one longevity company in the world for about 3 years as a medical director. And now I've moved over to Apex MD. And Apex MD, the reason why I love that is they're interested in the full scope of nutrition, exercise being the foundational bedrock of all health. And how I use peptides is because I believe that people who are not well, it's an immunologic problem and a cellular problem, and mainly a mitochondrial problem. And peptides are great for that.
Agreed, 100%.
Yep. So that's how I ended up getting into the peptides. And quite frankly, people came to me initially asking for peptides. And I did my residency at Mayo Clinic. And one of the things I will give them credit for at the time is alternative medicine strategies. We were taught that if you don't know anything about it, you don't say anything disparaging about it. You shake your head yes, and you go find out what it is.
Yeah.
But you don't condemn something, and people are quick to condemn things that they don't know about. That's very common in the sick care model.
Or they don't understand. Yes, agreed.
They don't understand it, therefore you should not worry about it. And that's entirely the wrong answer. I love Google Docs who come in that have done everything and used AI to figure out everything they can, because if nothing else, I'm going to learn something, or I'm going to learn that I need to go research something.
Yes.
So
well, the good thing about AI today, I mean, we don't know what the quality of the information is. You still got to use your brain to figure that out.
You do.
But there are some really great people like Jim Lavelle and Seeds that are writing books. And
Correct.
AI is able to scrub that and give us some more updated information. I mean, peptides have been around 15, 20 years. This isn't new science. Yes, Eli Lilly and Novo Nordisk got their hands on it and have made it more mainstream, but they aren't new, and we've been using them for many, many years.
And of course, that's just for GLP-1s.
Correct.
Go back 100 years and look at insulin, which is a very large peptide. And then we can talk about oxytocin and vasopressin that have been around for 70 years. So peptides have been around a long time. And if you're, and I know you have a sophisticated listening group, but if you don't know what it is, that's just chains of amino acids. So what are amino acids? They're the building blocks for protein. So if you have put 2 amino acids together, they're considered a peptide, and all the way up to about 50, which is in the range of insulin. And what we know is that they are biologically active, and they were sourced initially from organs of animals. And then through chemical synthesis, They made them so they're more bioavailable in humans. But in essence, they are naturally occurring. Um,
Yeah.
and so
Uh,
like,
that's what's so great about them too.
correct. And therefore, you don't expect to have a bad reaction to them because they're naturally occurring in the body. And there's about 70 of them right now that are FDA approved for different things. People are used to the growth hormone, probably Cimarelin. They probably have heard of that. But there's other growth hormone siligogics that you can use or secretagogics that you can use. And that just means it helps you secrete more growth hormone. But there's things that help you with neuroinflammation, immunity problems, cellular mitochondrial problems so that you have more energy, which a lot of people don't have. And then there's neurotransmitter changes that you can get with certain peptides. And right now, there's about 140 being investigated, somewhere around that range, but there's 7,000 known peptides. So the question is, what exactly are they doing in the body? And where is, if you age, many times we get a deficiency in these peptides, like we do with a lot of things. So we get more inflammation, which is leading to aging. And so why don't we use the things that are naturally occurring that are very sensitive to certain receptors in your body that turn on and off the things that you want? So that's as close as I can get to a non-science layman's point of view. But what
Yeah,
I
and I
would
think
tell
that's
you,
what's important is we talk so sciencey all the time. We, like I said, we nerd out on this stuff, and
correct.
we've got to figure out a way to speak about it in a way that people understand it. I always say that there's going to be I every time I read a book on peptides or every time I do any type of research on peptides, there's 22 more peptides I personally want to take. I'm
Yes,
not a multi-billionaire. It's not going to happen. And
correct.
so I always say, like, my strategy for looking at peptides are what are the things I need to accomplish today?
Correct.
As I age, I'm 52 years old. I'm postmenopausal. I need to deal with the weight management issue that's been difficult with menopause. I have a neurotransmitter disorder that is really affects my memory and my cognitive health. And so I really need to address that. And then I'm 52 years old. I want to address my skincare issues. And
Correct.
so those are the things that are most important to me. I don't really like to dictate for the patients I work with what is most important for them. So if I have somebody who's not BMI over 30, but they want to try a GLP-1 and we want to use it for weight management or weight maintenance, I do it. I don't, you can get butt implants, you can get plastic surgery, you can do all of these things. Well, I'm not going to say, no, you can't do it, but I'm going to teach you how to do it the safest way possible. And I think that you guys at Apex MD and you yourself really feel the same way.
Yeah, absolutely. Absolutely. And I'll give you a little bit of a story that I ran into a gentleman recently at a conference. 73 years old from Southern California by way of New Hampshire, was a race car driver. 73. He
I
looked,
probably know him because I used to work with race car drivers, but that's a whole story for another day. I'll ask you
I'll tell
later.
you his name offline. But about a year ago, his bone marrow was failing, terrible knees, was walking with two canes, was kyphotic or bent over like an old man. So I'm looking at this guy. He looks 53. He doesn't even have gray hair. And he said that he was at the end of life as far as he felt. And he had felt terrible for about 10 years. So he started studying peptides on his own. Non-doctor, did not have a college degree. He started buying peptides online. And he was walking up and down stairs without any problem, no canes, head back to exercising, he told me that he was able to curl a 70-pound bar now, where before he couldn't even pick up the bar. Now he's got 70 pounds on it. And he said that his whole life has changed. His girlfriend, 20 years his junior, is into this. He met after this endeavor. Everybody who sat at our table at this conference with him could not believe he wasn't in his early 50s. He was there as a non-physician, non-provider to find out
Yeah,
more.
I get invited to a lot of these conferences. I know that for people that don't know what that means, I get invited to a lot of these conferences. These conferences are for medical providers only. So it's nurses, doctors, chiropractors. You have to have a medical license of some kind. And
Correct.
then there's this very small group of people, probably 5 out of 500, that are invited because they have
A
a
story.
compelling story. They've worked in the industry a long time. I actually had a doctor that was like one of the founding fathers of longevity that introduced me to all these guys and have opened that door for me. But it is very interesting to be the non-doctor in the room because everybody talks to you, and it's very, very fascinating you get this weird level of attention from that.
That's right. And at these conferences, they're going to talk to you about energy systems and cellular health.
And it's very sciencey. It's like
Very,
high level science. And you have to be, if you're not a doctor or a medical professional, you have to be self-taught in that stuff. So it's really interesting.
you do. And many of these people, like Jim Laval, who you mentioned before, who's
Yeah.
a pharmacist. And if you don't know, for your people listening, Jim Laval was also a bodybuilder.
Yeah.
What I like about Jim is like a bro scientist, except that he's also got the patches on the elbow of the sports coat, academic PhD
Oh,
brain.
yeah.
But
Well,
he
he
could
got
go
into
on.
it because he had a family history of obesity and diabetes, and he never wanted to go down that road. That was my background. I had not diabetes, but I had a family background of obesity, and I didn't want to go down that road. And so I love Jim is absolutely one of my favorite humans on the planet because he takes something that is so sciencey and he delivers it in a way that everybody just can understand it.
Right.
And he's brilliant,
And
absolutely just a brilliant human.
if you read his Metabolic Code book as well, how you put things together and organ systems together, it's amazing. And then Dr. Seeds, who's kind of a stalwart in this area as well, is an orthopedic surgeon who's now retired from orthopedics. But he got interested in this and got interested in going to medical school because his father, who was a physician, died in front of him while they were running at his high school when he was 17. And he actually has done fellowships in nutrition and cellular health. And so here's this orthopedic surgeon who knows more about how to produce ATP, the energy system for endurance and longevity. He knows more about those cycles than anybody I've heard. So those two people, if you have to read anything and get into the science, those are the two people I would recommend. And they've both been the president of International Peptide Society, and they've both been involved, I think, in A4M.
Yeah. Oh, yeah. And I agree with both of those and then anybody they cite in their books, I tend to go down those rabbit holes as well. I don't read those books, but I definitely read the articles that they use to write their books because it gives you such good information about peptides. The thing about peptides, to your point, is that there are so many of them. But there's really probably, I would say, 50 to 75 that are the most popular that we are using today.
Great.
What types of things are we using those peptides for?
Well, I'll cite some of the discussion I've heard from Dr. Seeds, and he would tell you, first of all, you want to address your immunologic health. So what does that mean? Well, let's say you've had mono in the past or Epstein-Barr virus. Let's say you've had herpes, which a significant portion of our population has been exposed to. Then you get COVID and you end up with long COVID. So that's an immunologic problem. There are peptides that can help you with that immunologic problem.
So give me an example of a peptide that we would use for that.
BBC 157.
My favorite peptide on the planet. I talk about it all the time like I'm an insane person.
Now, it could be oral. It can be injectable. You're talking about 1,000 milligrams or a gram injectable if you do that, or oral a day. You combine that with something called thymosin alpha 1. So your thymus gland you're born with, it is part of your immunologic system. By the time you're in your late teens, it usually has gone away in most people. And so that boosts your immune system. Now, why would we want to do that? Well, if you get a viral infection, it affects your mitochondria. Your mitochondria is the powerhouse of every cell that makes you produce something called ATP, which is the energy system you use for endurance. Your brain and your heart almost exclusively are using that mechanism. So if your mitochondria are affected by these viruses, you want to address that first. Now, let's say, oh, well, I'm just going to go, I feel like I don't have energy and my brain's kind of foggy, so I'm just going to go use NAD plus. What if your mitochondrial system, which is where NAD works, is not working well because your immune system is not working well?
And by the way, this is what I get so frustrated with the telemedicine model of I bought a GLP-1 for weight loss. And that telemedicine company needed an add-on to sell me so they could get more money from me. So then they started selling me NAD plus, telling me all the benefits of NAD plus. And it's not going to work for those people. It's such a waste of money because you aren't being treated holistically. We're just slapping add-ons.
That's exactly right. And some of the peptides are coenzymes that you need for NAD plus to work. So the first thing you do is you try and improve the immune system. When you improve the immune system, your inflammation goes down. So you might lose pounds of fluid because your inflammation is down. And then you address the metabolic health. So that's your blood sugar, that's your mitochondria, because now you're freed up to do that. And that's when you get into some of the mitochondrial additives like NAD plus, NR, nicotinamide ribose, niacin. So you can use a B vitamin. So those can be helpful. People know about methylene blue, not truly a peptide, but also used in that sphere. The whole idea is to improve your ATP production, the energy system. So what is things that you see? You see SS31, you see MOTS-C.
You just wait. So you just like took me right down to where I was going next. So the reason why BPC 157 got a lot of popularity was it became heavily regulated over the last 2 years by local board of pharmacies started really heavily regulating it in states like California. The reason why California and New York, the reason why this was so important, it hit the news, was because most of our professional athletes were taking BPC 157 for injury recovery. And so that's why people are like, oh, I've heard of BPC 157. So I always try to relate it back to what people have heard of. Another one that people really hear a lot about is MOTS-C. They heard about MOTS-C because for a lot of longevity doctors, MOTS-C is the precursor to taking a GLP-1.
Correct.
So why is MOTS-C so popular and all of those benefits? And why are people hearing a lot about it right now?
It helps efficiency of your mitochondria in very simple terms. So what happens if you make more energy for endurance activities, your heart, your brain, you can exercise better. And we can get into whole differences between men and women. Women are more mitochondrial driven from their energy system. And so they benefit greatly from that. Now, what happens is along with that is if you control your blood sugar with the GLP-1s, along with improving your energy system to produce ATP, you feel good. And that's the big thing. And neuroinflammation will be made better by improving your immune system, by improving your ATP, and also by lowering your blood sugar.
And with GLP-1s, we have a little bit of fatigue. And so if you improve this ATP, you improve your energy levels naturally. So
Correct.
That's helping support that GLP-1 on the back end. I do find if I piggyback BPC 157, I use it for gut health in some of my clients because my clients, I had a weight loss business for many, many years, doing it the hard way.
Yes, ma'am.
And I don't say it's the better way. It was the worst way. Let me tell you. But I had a weight loss business for many, many, many years doing it the hard way. And so GLP-1s were the holy grail for especially my PCOS clients, anybody with insulin resistance.
Absolutely.
But there was a lot of issues with GLP-1s, and there still are. And so things like BPC 157 for gut health and then MOTS-C really were the holy grail if I could give all three of those, if people could afford all three of those. Now, if they can't afford it, I am going to use the GLP-1 first because I got to get their risk of heart disease down or fatty, non-alcoholic fatty liver disease, cancer, diabetes, all of those things. I needed to bring that risk down. But for me, those are the three that I love. If you have a weight loss issue, I love starting with BPC 157, MOTS-C, and a GLP-1.
And I don't disagree. And I will tell you the thing that was when I started out with GLP-1s, Well, what do you do about those clients or patients that can't even tolerate the lowest dose for weight loss? They're in bed for 3 weeks after their first dosing.
Yeah, I
That's
actually, if they get a microdose and they're sick, I give them Motzi. I go Motzi first because I don't have any side effects from Motzi.
And see, I would tell you that I am pivoting now to looking at their immunologic health.
Yeah,
Get a viral infection history. And I say, okay, if they have any autoimmunity, especially for thyroid, well, then I'm going to address the immune system. And then my next month, I'm going to bring in the GLP-1s at a low dose and the MOTS-C.
and see if they can tolerate it.
Now, it speaks to how you use these. So BBC 157 is naturally found in your stomach. And so it's not denatured by the acid of your stomach. And that's a problem for most of our peptides because they are. So they'll break apart into amino acids and won't have the same signaling once it's absorbed where you want it to be. So unfortunately, many of these are injectable right now. And there's a lot of people that don't like injections. Now, these are sub-Q. And so they're just below the skin. It's usually a minimal amount of volume. But still, some people just do not want to do that. So the future is looking for alternative strategies for delivery, transcutaneous, intranasal,
Sublingual.
sublingual, troches, so that you absorb it in the mouth and it doesn't get exposed. So those are
We know that glutathione has really been pretty successful with like the absorption in the mouth and passing the stomach barrier.
even spraying on your skin.
Yes,
For some of the persons. Yes. Now, unfortunately, there's a sulfate that goes along with that. So you smell like rotten eggs if you spray it on your skin. But there's definitely with the idea is that not just now, some of these peptides we know a great deal about, but the future is how do we deliver it?
I agree with that.
More people will be able to use it at a cost-effective pricing, but also
I was going to say that they're so helpful. And I've said this to you when I've talked to you in the past, including on my podcast. COVID opened this door for us because people sat at home, and I don't agree with this, but people sat at home looking for a reason not to comply. They stumbled onto functional medicine because we had some used car salesman trying to get people not to comply because their businesses were being affected by the shutdowns. But the good thing that came out of that is people stumbled onto functional medicine. Prior to COVID, this was all woo-woo. Nobody wanted anything to do with it. Now everybody wants something. Every single day I get asked a question about peptides from somebody walking down the street when they find out what I do. We've got to make it affordable, and we've got to stop talking about insurance covering it. Because the minute the mainstream manufacturers get their hands on it, the costs are going to be exorbitant, and we're going to have all these. We've got to figure out a way to easily deliver them, easily prescribe them. Since you are the chief medical officer I work with, and I want to make it as easy as possible for you to prescribe the right peptide and the right peptide combinations and make it affordable.
Correct. That's the goal. And I can tell you just in general, like what you said with COVID, we know that the model for the future is probably going to be having catastrophic health insurance. And then because you have that, you do an HSA, which whether you like the big, beautiful bill or not, it provides more money that you can put into an HSA so that you can purchase your own health up to that and you make your decisions. So more and more companies.
And I will say, I'm going to go off on a little bit of tangent because that's what I do and you know me for it. So to that point, some of us, a lot of us don't agree with most of the big, beautiful bill. I think it's really important to, regardless of what your political affiliation is, you guys need to read it because I have the Affordable Care Act. That's my insurance. I'm self-employed and it decimates my insurance. I will be on catastrophic only come October because it decimated funding. But and by the way, without the Affordable Care Act, I had pre-existing conditions. So it was a complete game changer in my health was the fact I had access to the Affordable Care Act. So it's really important that everybody out there reads the big, beautiful bill. I know it's really hard to get through. I've done it. You've done it. Yep. Figure out what you can get. Even if you disagree with it, We got it. So you better figure out what you can get out of it. And that's going to be really important.
Well, and I will tell you, I just went on Medicare. I pay more now for Medicare monthly than I did when I had my own insurance.
If you lived in California, though, you'd have Medi-Cal, so it would be a little bit better.
Well, possibly, but it's based on your income. And
Yeah, that is true.
2023, even though we're in 2025. So I'm paying a monthly amount of over $500 a month for Medicare
Yeah.
because of what I made in 2023.
But I will tell you, your Medicare insurance covers a lot. So
does.
it won't cover a GLP-1, but it
Yeah.
covers a lot.
And I have TRICARE for pharmacy, so that helps because I do have that. But I'm also paying for my TRICARE, none of which I thought I was going to have to do when I was 40, right? So,
No. We never think about that. At 52, at 20, I never thought I'd have to do this.
right. And that's what it was advertised as you never have to do. So one of the things it does do, though, is if you have an HSA because you have catastrophic health plan, is it doubled the amount that you can put in an HSA, which can be pre-tax money. So if you're self-employed, you take that off. It looks like you have a lower income, so there's a benefit to that. Anyway, the reason.
And by the way, no, let's not scoot over that. That's a huge benefit if you are self-employed. And I think a lot of people that tune into podcasts and things like this, they are looking for these solutions right now. So if they put it in there, it makes their income look lower. And they can use it for their GLP-1s. They can use it with places like Apex MD. They can use it. Some telemedicine companies don't allow you to use it, but you need to seek out, like a lot of my longevity doctors all take it now. It's like a credit card. You just use it in their offices. So it's very simple to use.
I think now it's gone up to close to $7,000 to $8,000 for a single person and about 17 and a half. So it's doubled the amount per year that you can put into that. And the great thing about the HSA is it carries over.
Yes.
Where an FSA goes year to year, and if you don't use it, you lose it. But an HSA is a savings account. So if you use 3,000 of it and you put 7,000 in, you got 4,000 at the beginning of the next year, and you're adding on.
This is actually a very important conversation about the future of peptides.
Yep.
This is going to be your credit card that you use to purchase your peptides. Because I'm telling you, you turned me on to CMAX. I have a neurotransmitter disorder. It's the best thing you two. I mean, if my only purpose for meeting you and Randall was to get that one peptide that I had never heard about because it's a little obscure. It came from Russia. A lot of people didn't know about it. You literally saved my life. And I said this to Randall last week. Had you guys not just sent it to me, you didn't know I had a neurotransmitter disorder. You just sent it to me to see if I would like it. It was such a game changer in under 4 days. I built 2 websites. I have been sleeping like a baby. I have no neurological tremors anymore. My mental clarity is unreal. And I haven't gotten in an argument with anybody. And I've had a lot of very extreme situations lately. And I truly believe it's all because of CMAX. Now, I said, there's 7 peptides I could use. So I need that card.
Yeah, but you have CELAC in there as well.
I do have CELAC in there too. I got your double dose.
That's the one that takes your anxiety down and is the mood stabilizer.
Yeah.
The CMAC is more for cognitive things. So things are clicking better. You got, you're firing all cylinders. The CELAC is the one that helps you stay calm. Helps.
It's unbelievable how I have the worst road rage, and I'll sit there and I'll be like, sure, come on over.
Yeah. Yep, that's exactly right. So the combination of those two can be great. And the nice thing is if you just need CELAC, it does come in a nasal spray.
Yeah, and CMAX comes in nasal spray too right now, but the research is not what I think where it needs to be. But I am really excited. That honestly, you guys call it Limitless. That's your proprietary product that you guys, and it isn't. So let me point this out to everybody listening. It isn't the fact that you can buy the raw ingredients of CMAX and CELAC. You can get those at a research pharmacy. That isn't what makes peptides great. It is the delivery method, how it is delivered, and there are some precision deliveries that are needed.
Yes.
And third and the most important is what are the levels of each. So it isn't what is the dosing of each. So it isn't just go get your CMAX and go get your CELAC and start injecting your cells because you guys aren't going to have a clue how to do it. So this is why it's so important to work with people like Apex MD that actually know how to put this all together. So you guys call it Limitless. It is the biggest game changer in my lifetime. I can't thank you
I
enough.
think that's great. And there's some pushback on combining peptides. We've done it in the past. Obviously, we've done it with growth hormone releasing peptides along with CJC 1295. And so we
Yeah.
have done it before, but now you're seeing 2 or 3 or 4 peptides put together, depending on what you want from it. And so what you got is the 2 peptides together for
Yeah, but
that.
like even like I use BPC 157 and TB 500. If I buy those separately, I have to reconstitute them separately. Then theoretically, I should be injecting them separately. That
Correct.
is just so difficult for me to do. Like I have got to stick 2 needles inside of my shoulder. That's at 5 days on, 2 days off. Like that's a lot to ask of somebody. But by you guys combining these peptides and giving us a better delivery of BPC 157 with TB 500 for direct delivery in one vial, in one injection, I think that controversy is going away quickly.
And I think the argument is the separate injections might be the perfect, but you've got the really good when you combine them, and you don't want to throw out the really good for the perfect. And it's exhausting. You get needle exhaustion if you're doing 2 of those every day for a while. So the idea that if you can simplify the whole regimen of delivery and it's still really good. So if you want to argue effectiveness and it's slightly less effective because you're combining them and the dosing may be a little bit off, okay, we can have that argument. But again, I want people to be able to use it to get the effect.
Yeah, and
And
I think the future of peptides is the number of peptides we have available to us, the delivery methods, making it affordable, being able to use your HFA to get there,
yeah,
the combinations of peptides that we are going to start seeing people use as well. And then I think the last future of peptides is how often they need to be dosed or delivered. So we have some like CMAX that some people are taking it twice a day. They use it in the morning and they use it in the afternoon. I couldn't use it in the afternoon because it kept me awake at night, which I thought was very funny. For something that was supposed to, the CLAC was supposed to calm me. And I was like, my mind was like, how much can I get done? It's 11 o'clock. I'm laying in bed and I thought of 32 things I needed to get done. And so I moved it to literally first thing in the morning. But then
right.
I still have to do BPC 157 at night. And then I microdose a GLP-1 every 3 weeks. And I needed to do that. So I truly believe the last future of peptides that we need to talk about is how long in between you're going to be able to start taking those. Because a lot of peptides started, even GLP-1 started with a daily dose. And now
Yeah.
we're microdosing them every 2 weeks, 3 weeks.
Yeah, so they were able to modify the GLP-1 so that it affected something called DPPP4. So that would degrade, and we know that a lot of peptides have a short half-life. So one of the things that they're for the future is extending the half-life, and that's why you have GLP-1s that are once a week or twice a week if you want to split the dose. But the bottom line is the half-life is much, much greater. It's hours to days rather than a couple of hours. And
Yeah, and I
so
do think some doctors do them daily because they like the overlap effect because they don't want people to go up and come down. And so, especially with like a GLP-1, when you get to the end of the half-life, the food noise comes back, the hunger comes back, things like
right.
that come back. And so I have a lot of doctors that actually split those into 2 doses because they like them to overlap. Where the
Agree.
the once a week protocol brings you up and kind of brings you down, and so or it actually starts you high and then you come down. So
There's the advantage of not having the auto pen that only gives you the delivery that you're going to get. You can't split the dose. Where if you're
I
putting
don't
it up
think
yourself,
I think maybe auto pens might be the wave of the future. The clickable, the ones where you can change the
clickable.
dosing on the auto pens.
Yeah.
But for me and my patients, I much prefer vials. There's so much more I can do with vials.
So the clients that I've had that have not tolerated the early onset, even splitting the dose and sometimes even doing it 3 times a week, something like generic liraglutide that you do daily.
Yeah.
may be a good choice for them. So, you're going to have weight loss. It may not be as profound, but what you're going to get is tolerability because it's a day-to-day thing. So they're not down for 2 weeks after they've done it for 3 weeks because it's built up because the half-life is so long.
I also want to talk about that weight loss. I think that we need to stop talking about weight loss. For 90% of these people that are obese, they're on a trajectory of always gaining weight.
Correct.
At some point, we just got to stop them from gaining weight. So
Right.
I think that is a great option. I keep calling it weight maintenance or weight management.
Correct.
We got to get to a weight management state before we're going to have weight loss. So this is why when we put them on super low doses of their GLP-1, that's truly to stop them from gaining weight. And they're like, yeah, but I'm not losing any weight. Yes, but for the last 20 years, you've been gaining weight. So
Correct.
this is a win that you're maintaining your weight. That's a good thing. We'll get you to weight loss through some lifestyle intervention with that. But for right now, we just got to stop you from gaining weight.
Well, and I would say also because of the improvement of your metabolic and your immune health, that you're more apt to lose weight because you have the energy to do other things.
100%.
The benefit. And I think the people who point out people are cheating if they use GLP-1s miss the whole metabolic health part of this.
Well, thank God for Serena Williams, because nobody can say that woman is cheating and nobody can say that she is lazy.
Yes, exactly right.
They got rid of Jillian Michaels. Did you notice Jillian Michaels got really quiet for an entire week because Serena Williams was like, you're going to come after me?
So Jillian Michaels being quiet for a week in the last 20 years is phenomenal.
1,000%.
And anybody that ever that saw the documentary on Biggest Loser realized that there was a lot of things going on that we didn't know about.
And she's suing everybody over that documentary, even though they asked her to appear in the documentary, but she didn't want the evidence against her in the doc. She didn't, believe me, that woman has never missed an opportunity to appear on TV, and she didn't appear in that documentary. There's an absolute reason why.
Absolutely right. So I can tell you that that's the thing that always hurts my heart when I hear people accusing others of just not having the discipline and the wherewithal to do it. There's many, many reasons why people gain weight, and it's not just because there are too many calories in and they're not exercising. We know that your gut biome plays into that. And so if you were sick as a child, got lots of antibiotics, we know your GLP-1 natively is not as high. So we know that you're more prone to do that. So getting you to a place where you can control that and not lowering your calories so that you have the non-exercise thermogenesis going down. So it's harder, you're going to reset and you're not going to lose, you're going to plateau. Getting them past that, but more importantly, getting them neurologically healthier, getting their metabolic system healthier, getting them lymphatic system to work better, getting rid of the inflammation so that they lose water weight they're retaining because of their inflammation. Those are things you see with the GLP-1s and other peptides.
With a lot of other peptides, that is like the biggest game changer for me on a lot of peptides, I shouldn't say all, is the fact that they are either anti-inflammatory or neuro-anti-inflammatory, and multiple ones of them are. Like the people that take a GLP-1 and they're like, I lost 10 pounds in a week. You didn't lose 10 pounds of body fat in a week. That was all inflammation you lost in your first week.
Correct. It's exactly right.
I could have given you 3 other peptides and had the same result.
Now, if they're losing 10 pounds a week after that, I get concerned.
I agree.
So
100%.
It should be 1 to 2 pounds a week. Sustainable, working out, great nutrition, keeping their micronutrients where they need to be, so that at the end of a year, when they come down to a stable dose or they're off of their GLP-1s, they can maintain.
Agreed.
Yep.
So Dr. Bowen, if you had any advice for people that are really interested in getting, you've given them a bunch of hacks along the way. This has been such a great conversation. But so in addition to the HFA, in addition to the books that you recommended that they read, do you have any other suggestions for people that are really interested in peptides and want to get interested in their own health and their own longevity and getting involved in peptides? What would that advice be?
Well, I think that there are sites that you can go to. They're informational only. There's a place called peptides.org that probably look at the 20 most common. and they have weight loss peptides in there, but they tell you about how it's made. They tell you about the research, including human research. And so you can actually look at that. They will tell you what they think is their preferred place to go to, which is probably going to be research. And when you get a research peptide, it's going to say not for human use. Okay. And it's,
and you're going to have to buy, you have to reconstitute it. So you got to buy that elsewhere, but right. They give you instructions. So.
And the purity, some of the places are 99, 98%, but the problem is they're not FDA regulated compounding pharmacies. So I would tell you that if you want to get the best mix that would be the safest, is you do it through a compounding pharmacy, which usually means it's recommended by a physician who does peptides.
Yeah.
And I think that that's the best way to go for safety.
Agreed.
Prevent the impurities. So I would recommend that. Now, I would tell you that peptide science is probably the biggest investigational peptide site. It's actually more expensive than getting it through compounding pharmacies many times, but they also have wonderful educational platform on their site.
They also send out like an ebook. If you join their newsletter, they send out an ebook every month on like 3 peptides.
They do. And I think that I definitely have had people that have self-explored peptides and have had remarkable improvements just learning it on their own. But I would tell you, for safety reasons, going to an FDA regulated compounding pharmacy and using a physician to design the course. Again, immunologic health, metabolic health first. Part of that's weight loss. But I think if you don't address the immune system because of viral injuries to your mitochondria, some of the peptides are not going to work as well. So what you want is to get the biggest bang for your buck from all your peptides.
So that's why they should work with people like Apex MD.
Yes, ma'am. Exactly.
You guys speak my love language. You treat your patients holistically. You really care about their overall health, which I appreciate. Yes, there are other medical offices. Jim Lavelle's medical office. He's got 2, one in Texas, one in Southern California, and he really cares. He's brick and mortar, so if somebody wants brick and mortar, they can go there. Dr. Chiriano, he's in Southern California. He really cares about, and he's brick and mortar. So, but to me, I think everything that you're saying really comes down to who you choose as your physician that's going to help you navigate this is just as important as you understanding the peptides themselves.
And I don't know, you'd have to tell me, I'm not a member of A4M, but I would imagine they have a physician registry that
they do
have done their fellowships. And so state by state.
Or just hire any of their speakers. Almost all of their speakers have active longevity clinics. So that's another way that you like, if you like I love Gordon. I think he's a weirdo that's like super brilliant. Yep. I would go to his clinic in a heartbeat because he speaks my language. And I think and all of their conferences are available online for a fee. And I think it's well worth listening to these people talk, and that you don't need a medical license to attend.
Do not need a medical license for. And I agree.
So that's a great way too.
You're looking for somebody local. That might be a source destination, is to go to their website and see if they have the.
But I don't want to make people afraid of telemedicine. I think people like you guys are doing telemedicine correctly. So I think people are a little nervous about telemedicine. And I did start saying like telemedicine doctors are doing this wrong. And so I do want to make sure I reiterate, I don't think all telemedicine doctors are doing it wrong. I think the Hims and Hers and Rose and those, they're looking for a quick buck and they're not actually treating you holistically as a patient. But places like Apex MD and other telemedicine I work with are doing a phenomenal job of doing holistic longevity care
through the telehealth platform.
Yeah, it makes it convenient for you as a patient, makes it convenient for you. I get access to one of the top longevity doctors in the world, Dr. Bowen, truly only because it's telemedicine. I wouldn't have access to you otherwise.
And you don't wait in the waiting room?
No, and I don't have to fly to Florida. And I've had to fly to New York in the past to work with other doctors. So
absolutely. So
well, Dr. Bowen, thank you so much for joining me. I appreciate you so much. And we will do this again sometime soon.
Always a pleasure, Sharon.
I want to thank you for tuning in to the Weight Loss Decoded GLP Edition podcast. My name is Sharon Polsky, your GLP Fact Fairy. And if you liked today's episode, if you could please subscribe, like, and share with your friends, that would be great. I also want to remind you that these are just the opinions of myself and my guests and should not be interpreted as medical advice. Until next time, ciao for now.